Welcome to the Morris Animal Foundation scientific webinar featuring the work of Dr. Elizabeth Rozanski. We have an informative half-hour plan for you today. My name is Leslie Hansen, and I'll be moderating today's webinar. Before we get started, I'd like to review a few housekeeping items. To eliminate background noise, you have been placed on mute. If you have a question at any time, please feel free to use the question feature that should appear on the right-hand side of your screen. At the end of Dr. Rozanski's presentation, we will have time to answer a few questions. Dr. Rozanski has graciously agreed to respond to questions we aren't able to get to today, and those will be emailed to you by the first week of September. Before we get to Dr. Rozanski's presentation, I'm pleased to introduce Dr. David Howard, Morris Animal Foundation's President and CEO, who will say a few words about the foundation.
Thanks, Leslie, and welcome everybody. That picture was not only of me, but also of my puppy Bridger, which I know might sound shameless, but you know, when you've got a puppy like that, you just take advantage of every minute. So Morris Animal Foundation is a fascinating organization. We were founded in 1948 by Dr. Mark Morris, Sr., who was a true pioneer in veterinary medicine and in nutrition. He had the first companion animal practice in Raritan, New Jersey, and then invented what became Hill's Science Diet. And when he invented that, he decided to donate a portion of the proceeds to science to benefit animals. And he said at the time, they've given us so much, isn't it time we gave them something back? For the last 65 years, Morris Animal Foundation has remained a leader in supporting science, advancing the health of animals. And while our relationship with Hill's has changed over the years, they're still a proud partner, although not nearly the largest partner that we have. To date, we've invested more than $70 million into funding more than 2,000 studies. Our studies grant applications are evaluated by the leading scientific advisors in the world, mostly faculty at veterinary schools, highly independent, and they score these on merit and impact. We are dependent on donations from animal lovers around the world. Veterinarians, associations, corporations, all see the value of our mission and give us the proceeds that enables us to do this, but there's so much more that still needs to be done. We're also very proud to be a 4-star Charity Navigator rating. So we've got about 250 active studies going on at any given time. We fund a lot of faculty at veterinary schools. We also fund a lot of research at zoos. We also fund a lot of students in order to get them started on a career in research to provide the answers that your veterinarians need to solve the most pressing health problems in our animal friends. We fund studies in all areas of science. We don't proactively go after any specific area, and we basically follow where the science leads us. And then lastly, we fund studies in all species except production animals. We fund mostly in dogs, cats, horses, and wildlife. Benefits of our research are huge. We've improved treatments and diagnostics. Much of the work that your veterinarians do with animals comes from research funded by our foundation. We funded early work in vaccine for major diseases that were huge killers for animals. And we've improved dietary management in dogs, cats, and horses. With that, I'd like to introduce our speaker today. Dr. Elizabeth Rozanski is an associate professor at Tufts University Cummings School of Veterinary Medicine. She is double boarded in both internal medicine as well as emergency and critical care. And we've been a great partner with her over the last several years, funding over $73,000 for GDV Bloat. And that's what she's going to talk about now.
Okay.
Dr. Rozanski, are you ready?
I'm ready. Can everyone hear me okay?
We're reading you fine.
Perfect. Well, I'm very honored to be here, and I'm very appreciative, obviously, of all the support from the Morris Animal Foundation. My job really is as an emergency doctor, and so one of the diseases that we see a lot in the emergency room is bloat, and that's obviously what we're going to be talking about today, and that's probably why people are in specific interested in what we're doing with this. So I want to review not just a discussion on bloat, but also in specific what the Morris Animal Foundation has helped us try to investigate so we can learn a little bit more about this disease process. So we can go on to the next slide. So we'll start here. So I think most people are familiar with what GDV or bloat is. Certainly it's known as one of the big killers in the large deep-chested dogs, and it's one of the diseases that as veterinarians we spend a lot of time talking to people about, trying to get a better handle on why it happens. And the bottom line is we still are, while we learn more every year about things that cause it to happen, we're still not 100% all of the things that are players in an individual dog. We know for a fact that there's genetic relationships, so if you have a sibling that's affected with bloat or a parent, that can increase the risk. Certainly breeds that we'll touch on in a minute are more likely to be affected, but what makes that individual dog bloat on a specific day is one of those things we still don't know. We do know it's not the full moon. People used to think it was that, but it's definitely not the moon. But basically what happens in bloat is the stomach starts to distend with air, and then instead of able to have air either go out through the esophagus, so have them belch it up, or pass through the intestines, the stomach basically rotates on axis and cuts off the ability of air to leave the stomach in either direction. And then we've also recognized that it's not just air that in the stomach that they've swallowed, there's also kind of a fermentation chamber in their stomach that makes that stomach distend further and further. And when the stomach is very distended, it does damage specifically, of course, to the stomach, but also it damages the rest of the organs inside the abdomen, specifically the spleen, and it cuts off blood flow to other parts of the body. So that's something that can be really hard to for these patients because we don't have a good way to get that fluids to come back. So we'll go on to the next slide. And what this is this is kind of a creepy picture, so I apologize because I know it's close to lunchtime. But on the left-hand side, you're going to see the radiograph. That is the very classic, typical finding. We often teach our students double bubble, dogs in trouble, and you can basically see a line in that huge black circle is the stomach, and it's really distended with air. It should normally be barely visible on that radiograph, and it's got a shelf or a line of tissue, which is where the fold or the twisting has occurred. And so this is a right lateral x-ray, and this is the type of x-ray that we take to identify this problem. On the right-hand side of your screen, what you're seeing is an actual picture of a ruptured stomach. And so right over where the arrow is, you can see that the surgeon is holding up a piece of stomach, and I know this looks gross, and that gray area is very, very unhealthy stomach that's actually had its blood supply cut off, and that piece of that stomach has died, and it's so badly damaged that food is actually spilled out into the abdominal cavity. And this is a type of dog that we see this dog at surgery. Even with prompt surgery, this dog's chances of survival are actually very low, and that's one of the really big things we're interested in looking at. Let's go on to the next slide. And so what this is a movie of a CAT scan. And so just to get you oriented before it starts to play, you can see this is his stomach through up and through here. And this is the whole stomach with that line of demarcation, putting pressure on all the abdominal organs, and through here blocking blood flow back to the heart. So we don't normally do CT scans on dogs with bloat. This is something that we were supporting in a research project to understand a little bit better what happened into the internal organs, but I put it in here to give us a better understanding of really what happens anatomically. We kind of all think about our own stomachs maybe after Thanksgiving dinner where you feel like you just need to lay on the couch, and this is about 10 or 15 times more dramatic than that. So these dogs are really uncomfortable, but they're also affecting their vital organs. So go on to the next slide. When we think about who's affected by GDV, it's very common in large, deep-chested dogs. This is a English setter, you can probably see, called Honey, who was very, very loved, is very, very loved, and had a very bad case of bloat. And you can see there's her family pictures on the side of her run as she's working to get better, and the running shoes when she gets to go home. From a clinical standpoint, what we worry about is morbidity. It certainly causes these dogs a fair bit of discomfort and pain. It can cause difficulty in recovery, and it can cause organ damage. And then we also know that some dogs don't survive. When GDV first made it to the veterinary literature, the survival rates were dismal. Over the last about 20 to 30 years, survival rates in treated dogs have kind of hovered right around 80% or so. And so that's not bad, but that's still 2 out of 10 dogs that we're losing to this condition when their families have elected to try to treat them. And that's too high of a number for us, and that's, again, what we've been working with the Morris Foundation and trying to fix. The next slide. So what our hypothesis was is, and what we're really looking at in these dogs, and for those of you who may have had a dog with bloat, what you recognize is some of the dogs will have a surgery for bloat. They're basically home the next day and they never look back. But then there's this subset of dogs that have a very profoundly inflammatory response. They develop what we feel is a clotting hypersensitivity of clotting, or develop a condition called disseminated intravascular coagulation, where basically the inflammation from the disease causes their blood to start to clot in circulation. And the clotting system is very nicely balanced so that clotting doesn't normally occur in our veins or in our arteries. And so our hypothesis was this bloat results in a procoagulant, so excessive clotting forming in the bloodstream. And when it does that, it blocks off vital organs. And that the thrombosis to these organs decrease organ function and lead to organ damage and death. We know that just like people, dogs that have increasing numbers of organs failing end up not surviving that. We also were feeling that abnormal heartbeats and cardiac dysfunction were common, and specifically what we hadn't looked at before was this syndrome of multiple organ failure or multiple organ dysfunction, which basically means you may start out with one organ system not working, but over time you find that the other organ systems start to shut down as well. And kind of almost like a domino, as each organ system goes, that patient's chance of recovery really lessens. Let's go on to the next slide. So our study methodology, basically did 2 projects with Morris support. One was we were retrospectively planning to look at around 200 records of dogs presenting to our emergency hospital with bloat to get a better sense of what was happening with them and what we were looking at. And then we also prospectively enrolled dogs that came in with bloat and followed them through their clinical course with blood samples and other forms of monitoring about every 12 hours until they were discharged home. I'm sorry. Next slide. So again, a retrospective evaluation was looking at all dogs presenting to our hospital for suspected GDV and looking at who they were, what happened, and did they develop organ dysfunction. To the next slide. Prospectively, so following over time, we were looking at a special clotting test that's called the thromboelastogram, which is a test that actually measures this hypercoagulability phase, measures the patients that have over excessive clotting foundation, look at the specific clotting times. We also looked at their heart with echocardiogram, just like dogs get for a lot of different diseases. We monitored them for organ function, specifically problems with the respiratory system, the kidneys, the clotting system, and the other body systems. Our next slide. So what we found was actually we started out to look at 200 dogs. We got kind of zealous and we ended up looking at almost 500 dogs. What we found was similar to other studies, a large percentage of dogs were German Shepherds and Great Danes. So again, confirming the hypothesis that these big, deep-chested dogs are most commonly affected. What we found that has actually never been reported before was the percent of dogs that were euthanized at the time of diagnosis. And so the prior bloat studies that are out there look at them and they kind of exclude that category of dog and only look at the dogs that had intent to treat, where their families elected to proceed with surgery. And what we identified was almost 1 in 4 dogs that presented to our hospital. We have a busy emergency and critical care service, and we also have a hospital that we call ourselves a hospital of treaters. Most of our clients are very keen to treat their patients. We don't have a lot of off-the-street euthanasias like some emergency services do. And even with that, 1 in 4 of these dogs were euthanized without even an opportunity to treat. So this is actually a really big area that I think that's we need to focus on, is getting the knowledge out about this disease and getting a better ability to deal with this at the time of the initial bloat situation. Of the dogs that were treated, so 75% of the dogs were treated, 84% of them survived. So again, the prognosis is reasonable, but we want to see that number as close to 100 as possible. So again, this was a pretty big undertaking with determining the percentage of dogs that didn't survive just based on the diagnosis. To our next slide. So again, of the 500 dogs, almost all the dogs had a condition called systemic inflammatory response syndrome, or SIRS, and what this is an early warning sign that these dogs are going to be at risk of developing organ failure or organ dysfunction. And so what we identified in them is they had faster heart rates than a normal dog. Many of them had fevers. Some of them had altered white blood cell counts, a rapid respiratory rate, and these are the signs that their body's responding to something. We also, as suspected, identified that dogs that developed an organ dysfunction, whether it be clotting system or kidneys or heart or lungs, were more likely not to survive, and dogs that had more than one organ failing were much more likely not to survive. So again, this was very supportive of what our hypothesis was, but hasn't been documented before. Of the organ systems that could fail, the clotting system was the one that was most commonly affected, and really gives us a target for trying to treat. This also makes sense from recognizing that the multiple organ dysfunction syndrome is a whole body disease, and that coagulation can affect every part of the body. And so coagulation dysfunction was a really, really big player in why these dogs survive. Additionally, I showed you, if you can remember back to the picture of the dead-looking stomach, dogs that had their spleen removed, which is commonly damaged in a dog with bloat, or had part of their stomach removed, were more likely to have multiple organ dysfunction, and they were more likely not to survive. And kind of circling back to this a little bit, for many years in the bloat literature, and when people have looked at studies, people have said things or established things that if your dog had part of the stomach removed or part of the spleen or the whole spleen removed, that that dog was less likely to do well. And so what we really identified was it wasn't taking out the spleen or taking out part of the stomach that made more likely to do poorly. It was that these are markers of the severity of the disease and the systemic inflammation and organ dysfunction accompanying that. So again, they're poor prognostic signs to have those removed, but it's not taking them out, it's what the systemic effects of that is. So on to the next slide. And so again, our major take-home points to me is there's a really unacceptably high rate of euthanasia diagnosis, and this is something that I think as dog lovers we can kind of all wrap our heads around. And the reasons for euthanasia in this population may have been, and no most of them, were age, cost of treatment, comorbidities in the dog, hip dysplasia, renal disease, and fear of the length of recovery. So a lot of different things as goes into almost all decisions for euthanasia, but a lot of it was unprepared for the extent of the critical illness. Additionally, we identified that severe illness associated with longer hospitalization or death is associated with organ dysfunction, and of the organs that failed the clotting system in this retrospective study of 500 dogs or 498 dogs was more likely to be affected. So now move on, I think, to the prospective area of what we found with the group of the dogs that we followed more closely. And so this was a group of population of dogs where I live about 1.5 miles from the hospital, so every time a bloat dog would come in, which usually is seemingly about 2 in the morning, we would run in and get samples from the dog as we were stabilizing for surgery. And so we enrolled and have a lot of data on about 27 dogs. Our initial plan was to enroll about 24 dogs, and we enrolled a variety of breeds. Most common were German Shepherd and the standard Poodle. Age range was between 3 to 15 years, and so again, when we look at this ages, we know that bloat is more likely in older dogs, but it can happen at any point, and the majority of dogs had already signs of systemic inflammation at presentation. Go to our next slide. is from surgical outcomes. So again, these are all dogs we identified they had bloat. We recommend them going to surgery as promptly as possible. At surgery, we actually identified about half of the dogs ended up having their spleens removed, and about a little bit less than half the dogs ended up having at least a partial gastric resection, and meaning that part of their stomach was assessed as dead, similar to that picture that we saw earlier on. And a third of the dogs had both a splenectomy, so their spleen removed and a little bit of their stomach removed as well. This is a little bit higher percentages, but it was a relatively small group of dogs than what has been previously been reported. Let's go on to the next slide. So from their survival standpoint, 21 of the 27 dogs, or almost 80%, survived. So a little bit lower number than our overall population. Of the dogs that didn't survive, 5 of the dogs were euthanized for a variety of reasons. 2 of them had subsequent breakdown of their stomach site where their gastrotomy or their stomach surgery was done. One of the dogs just was an older dog with comorbidities, including laryngeal paralysis and arthritis, and ended up just not recovering well from that. And then one dog actually died, despite a young Weimaraner, despite a lot of intensive care trying to save that specific dog. Go on to our next slide. From a global coagulation standpoint, we identified that dogs that didn't survive, which was thankfully, again, a smaller population, were much more likely to have thromboelastographic changes or TEG abnormalities, meaning that the dogs were either very hypercoagular or very hypocoagulable, depending on where they were in the disease process. And when the dogs got worse, and again, thankfully most of them didn't get worse, but in that population, a small population of dogs that worsened, their thromboelastographic, their TEG values also declined. Next slide. This is an example of a dog. This is Shadow, who was a dog that had severe bloat. The purple line here is the kind of purple spotted line is our normal value. Anything above that is a hypercoagulable or over excessive change. And so when Shadow first came in, he had a very excessive clotting system, more so than normal. And then the green and the kind of pinky lines show as his disease got worse that his clotting abilities really failed. And on the last day before we lost him, he had no ability to clot any longer. So again, really confirming, unfortunately, what our hypothesis was of why some of these dogs don't do well. Go on to our next slide. So what does it mean to us as suspected in critical illness? This activation coagulation system is a really big part of the puzzle. So that's obviously interesting. What does it mean more importantly is it might be that in some of these dogs at risk, treating them early on with heparin, which is a blood thinner, or low molecular weight heparin, which is a more specialized form of a blood thinner, might keep them from going on to develop that. And so we're looking to try to figure out if there's a way we can investigate that. And what we're looking for the sicker dogs, because we know that most dogs do well. So what is the sicker population that might really benefit from the therapy? So we'll go on to the next slide here. And so I just want to finish up a little bit talking about cardiac dysfunction. We've known for a long time that dogs with any sort of systemic disease will have funny heartbeats. And what we want to distinguish that from is abnormal heartbeats, or ectopy, from actual heart muscle, myocardial dysfunction. And so we did that in these dogs by monitoring their EKGs and also monitoring biochemical markers of what their heart was thinking, as well as looking at their heart with an echocardiogram. So next slide. So, and we'll play this as a little movie here of an EKG. And so some of you have looked at EKGs and you're going to see this looks pretty normal. This is an actual dog with bloat, and I'm a horrible videographer. But in just a second, you'll see the dog have a run of really funny looking beats right here, right at the end right here, where this is an example of a patient where this dog is having ventricular ectopy in association with his bloat. So again, we looked at their heart muscle on ultrasound, and then we measured 2 biomarkers, troponin, which is a measure of heart muscle death or necrosis, and NT-proBNP, which is a biomarker of left or right heart stretch if the heart is being overtaxed. So go on to our next slide. And what we found was that these dogs had higher troponin levels, meaning that there was specific microscopic myocardial damage. Most of the dogs had abnormal heartbeats at some point. Their heart function based on echocardiograms, so if you just looked at it as a cardiologist would, their heart looks pretty good, but at a cellular level their heart was actually upset shown by having a higher troponin. And we also saw that from a sensing what was happening with the heart was overtaxed by having an elevated value of NT-proBNP, which is a marker of heart stretch when the heart isn't happy with the amount of fluids it's getting. So we identified these things. The NT-proBNP in specific has never been established before, so this is an interesting area to look at as well. To our next slide. So kind of our conclusions from this study is that we've identified and confirmed what we were worried about is that persistent coagulation dysfunction is really highly associated with the poor outcome. We can see early evidence of coagulation dysfunction at admission in the non-survivors. And again, we're very lucky we didn't have a lot of non-survivors, but we could see it early on that they weren't quite right. And identifying that close monitoring of these dogs, of their coagulation system, potentially via TEG or the thromboelastogram, is going to be indicated in dogs with GDV, at least as we're continuing to try to understand better what really happens in this disease. And so I think that was really important. And I think as we look at this, we identified that the future studies could look at trying to prevent coagulation dysfunction. And again, just circling back to our retrospective study, where looking at ways to try to prevent early euthanasia of dogs right after they're identified with the disease is also going to be a really important target for us. And so that's what I have for today. Go on to the next slide.
Thank you, Dr. Rozanski. That was great. I think that this is a classic example of a disease that humans just simply don't get. And while billions of dollars are being spent for human health research, only a fraction of that gets spent for research which benefits our animal friends. We need your help. Obviously, through donations, we can fund more and better science, but also by sharing the information and sharing our mission, letting your friends, your family, your neighbors, your people at the dog park understand what we do will help us all make the world a better place for animals. So thank you for your attention, and please help any way that you can. And I'd like to make a specific request to anyone in the audience who might have a golden retriever under 2 years of age. We are recruiting 3,000 purebred golden retrievers for a groundbreaking lifetime study where they'll live in your homes, they'll be followed through the course of their lives, and it is commonly said it is the most important study in veterinary medicine run to date. And that you can find all about that at our website, morrisanimalfoundation.org/golden. At this point, we'd like to move to the question and answer session. I recognize that we're running very close on time, so in the interest of that, I'd like to ask 2 questions, and Dr. Rozanski and staff at Morris Animal Foundation will work to answer any questions we don't get addressessed. Dr. Rozanski, we've had a lot of questions come over about prophylactic gastropexy. Could you briefly just tell us what that is, what the benefits are, or any side effects, and how do you go about doing that if it's warranted?
Yeah, absolutely. I didn't actually have time to get into that. So prophylactic gastropexy is a method where before a dog would have bloat, if you have a dog breed at risk, you actually, through several different techniques, either as an open surgical approach or you can do it laparoscopically. So with a minimally invasive approach, you stitch the stomach to the side of the body wall to keep it from twisting. And it's by far and away the most effective method that we have to prevent bloat, and it's something that we really strongly encourage in anybody who has a dog at risk. I have a Gordon setter who's a dog at risk, and she got pexied when she got spayed. I think it's one of the biggest things that we can do to really improve or limit the likelihood that that dog is going to twist. Potential side effects from it are very uncommon. If the pexy is done at a funny angle, they can sometimes have what's termed an outflow obstruction, meaning they can have some vomiting signs. And through the years, we've seen one dog that got an infection at the site of the pexy, the site of where the stomach was sutured to the side of the body. But by and large, for the individual dog, it's the best recommendation that we have to keep that dog from getting bloat.
That's great. Thanks very much. Another and the last question that we'll try to address today is about other ways to prevent bloat in dogs that might be predisposed. Is there any evidence about feeding habits, feeding techniques, types of food?
Those are all excellent questions. And I think that the more you look at the literature, the more confusing it is. So one of the things people have talked about for a long time is not feeding of dogs from a height, and it turns out that doesn't really make a very big difference. So you can feed them any way you want. There's some discussion about not feeding a dog and then immediately exercising them, and for the thought that the stomach might actually flip over, and that actually seems like that's not true either. There's some thought that feeding more frequent meals so their stomach doesn't get very distended might make sense. But again, in the individual dog, there's probably not a good technique that really makes a big difference from that standpoint. And I would love to be able to say, if you just do this, he'll be fine or she'll be fine. But when we look at it from a feeding standpoint, none of the things specifically make a big difference. And I know you didn't specifically ask this, but the one thing that does seem really linked is dogs that are really anxious. And so if you, and from as my ER background, dogs that are anxious that are left in kennels or with friends are dogs, particularly in a boarding kennel, that are really predisposed to torsion. So if you're in a situation leaving the dog, make sure somebody knows what your wishes would be and make sure it's a kennel that watches them closely. But there's no good plan on the foods.
Great. Thanks very much. I'm going to turn it back over to Leslie Hansen.
Thank you. That's all the time we do have time for today, and thank you for spending your time with us. This webinar will be available on the Morris Animal Foundation website later this afternoon for your review or for you to share. We'd also appreciate if you could take a few minutes at the conclusion of the webinar to answer a few questions about your experience so that we can continue to bring you relevant topics. Thanks again and have a wonderful day.
Thanks, everybody.
Thank you.